My name is Sarah Present, and I am the Public Health Officer for Clackamas County, and I'm also a family physician in primary care at the Beaver Creek Health Center. I've been here for about 6 years. I'm also a mom of a 10-year-old, and I love Clackamas County because I love hiking everywhere in this county. Trisha J. says, don't expect our government to tell you truths about these vaccines. They're getting kickbacks from the pharmaceutical companies, and the pharmaceutical companies are making bank on these vaccines that will not receive official FDA approval for some time, if ever. Okay, Trisha J., thank you for that comment. This is a really weird time. This pandemic is a real virus that's killing millions of people around the world and in the United States. The fact that our government was able to assure our pharmaceutical industries that they would get paid is why we have a vaccine so quickly. So the rate of vaccine production was faster than we've ever seen before, and that is amazing because our government was responsive to what was needed to stop a pandemic. Phyllis S. says, the N95 box says does not prevent COVID. Useless. We've learned that COVID is more of an aerosol than we thought at the beginning, therefore the N95 is more important. I think when a box says it doesn't prevent COVID, that means that it can't prove, it hasn't done the research. It's been, maybe 6 months that they've tried to do research on this particular mask, and so they have to give a disclaimer. I know overall N95 masks prevent the spread of COVID. They help protect the wearer, and there's a lot of good mounting evidence that they help prevent the wearer from spreading it. Brandy W. says, the blood of those who killed themselves, those who were murdered by these ventilators, all those who died because they were denied medical services, their blood is on your hands. Ventilators are there to keep people alive while their body fights the virus, and if the body's unable to fight the virus, they may die, even with the ventilator. So ventilators do not kill people, and ventilators are not as useful in COVID-19 as they are in something like other pneumonias, including pneumonia from influenza. Okay, Liz W. says, vaccinated persons carry 251 times more virus in their nasal passages. Say hello to super spreaders. Yeah, that's a really confusing thing, isn't it? We can do a nasal swab and get a whole bunch of virus, but when we do population level studies, the vaccinated people are not spreading it like the unvaccinated people. I think that number of how many viral particles are in the nose is really confusing and doesn't mean infectiousness. Lynn R. says, do not get the clot shot if you're in your first trimester. Studies prove a very high risk of miscarriage. Lynn R., I have to disagree with you. I have seen lots of research, I've been following it, and there is very clear evidence that it does not increase your risk of miscarriage. We know that pregnancy can cause clots too, much greater risk than with vaccine. So COVID-19 disease increases your risk of miscarriage. The vaccine does not. All right, Jedediah G. says, the vaccine has a higher fatality rating than the virus. It's just not true. Absolutely not. I think that there have been under 10 true vaccine-related deaths that we are concerned about, compared to hundreds of thousands of deaths from COVID-19 disease. Over 4,000 people in Oregon have died from this disease. The fatality rate of COVID-19 disease is 1.4. That's incredibly deadly. If we can get it down to like 0.4 or 0.1, then it might be like the flu. The vaccine is not killing people. It's just not.